So in Israel, the situation is like this. Actually, the first identified patient in Israel was in February the 27th. So it's almost 2 months after the first case in China. And as of yesterday, we have more than 400 cases of identified patients in Israel. And we have 6 of them are in the intensive care unit. And unfortunately, 10 of them are IDF soldiers. And one of the problems that we are facing, and I'll talk a little bit about that later, that it's not only the number of the patients who are confirmed as patients, but it's the high number of the citizens beside these patients that they have to be in a protective isolation. In the IDF, you see that in Israel, for example, it's about 5,000 soldiers in the IDF that they are in a protective isolation. What are the role of the IDF in the national support in this war? First of all, we are taking care of recruitment of blood for the National Bank in Israel. We are part, let's say that in the daily manner, the soldiers of the IDF are donating almost 30% of the numbers of the blood units in the state of Israel. But since part of the citizens are at home, either in isolation or sick, so in these days, the role of the IDF, the role of the soldiers is even higher and more important. And that's the reason that we are taking care of this massive recruitment of blood donors. The other thing that's in the right side is the commanding civilian uniformed hotel hospitals. And again, we are changing a concept of thinking. Instead of having all the sick people at the hospitals, and since I said that almost 80% of them are suffering from a mild disease, so we started a new concept of having them hospitalized, not in the hospital, but in a hotel. And since you have to command this hotel, the ones who are doing that is the Home Front Command as part of the military-civilian collaborations that we have in Israel. The other thing is supporting the civilian system with manpower and logistic efforts. Again, the Home Front Command with the technologistic branch are doing much to support these civilians, that part of them are in isolation, part of them are elderly people who cannot go away, and we are supporting them as part of this these days. The other thing is the formation of newly military, again, like the civilian one, of hotel hospitals for infected soldiers. This separation between the citizens and the soldiers, it's very important. Since the soldiers are young people and the disease is a little bit milder than the others, so it's very important to have this separation from the soldiers, from the other citizens. And that's the reason that we actually formed these two forms of hotel hospitals, one for the citizens and the other for the soldiers. The one for the citizens, we are only helping them with commanding through the Home Front Command, and the military hotel hospitals actually is commanded and operated by the military. For the soldiers, in order to lower the burden of this disease from the civilian hospital, from the civilian health system. And the one that we are dealing with this weekend is the establishment of a military corona laboratory. And this is one of the things that actually could be a game changer, because sometimes we are lack of laboratories in Israel, and it's very important, the added value of the military laboratory is very important. And this is the thing that we are doing exactly these days. And hopefully until Sunday, we will have this laboratory operating, and it's for sure will lower the burden from the civilian laboratories and will facilitate the diagnosis of this disease. You see here soldiers who are converting these hotels to the hospitals, and you see here that this is the Minister of Defense visiting one of these hotels with a representative from the Home Front Command as part of the collaboration between the military and the civilian system. I already talked about the blood donors, and actually our soldiers and our commanders. I just finished a meeting with the Chief of Staff, and he said that it's one of the things that we have to do as a military, as commanders, as soldiers, to support the civilian system, also through the blood donations. You see that we are dealing with a lot of protective things. I already talked about the hygiene, that it's very important. And probably this is one of the things that we can, with these things, face the disease, and probably, let's say, will help us postpone the arrival of the peak of this disease. The military challenge, that beside all the things that we are doing, that I already mentioned, we have to continue taking care for the security of Israel, for the borders, and for the country itself.